This tutorial aims to guide you through the proper application of a combat application tourniquet and the situations in which it should be used. Step 1. Assess the situation. Before applying a tourniquet, assess the severity of the bleeding and determine if it is life-threatening. If the bleeding is not severe, attempt to control it with direct pressure or pressure dressings first. A tourniquet should only be used for severe, life-threatening bleeding that cannot be controlled by other means. Step 2. Prepare the tourniquet. Ensure the tourniquet is readily accessible and properly assembled before use. Familiarize yourself with its components, including the windlass rod and the securing strap. Step 3. Apply the tourniquet. Place the tourniquet proximal closer to the body to the bleeding site, ideally 2 to 3 inches above the wound. Pull the tourniquet tight and secure it in place using the securing strap. Twist the windlass rod until the bleeding stops. The windlass should be turned until the bleeding is controlled and the distal further from the body. Pulse is no longer palpable. Lock the windlass in place using the securing clip. Note the time of tourniquet application. Step 4. Monitor the patient. Once the tourniquet is applied, continuously monitor the patient's condition. Check for signs of distal circulation, such as pulse, skin color, and temperature. If possible, reassess the need for the tourniquet every 15 to 30 minutes, and consider loosening or removing it if medical help is delayed. Step 5. Seek medical help. A tourniquet is a temporary measure to control severe bleeding. It is essential to seek professional medical help as soon as possible after applying a tourniquet. Communicate with emergency services or transport the patient to the nearest medical facility for further treatment. Step 6. Document the incident. Record the details of the tourniquet application, including the time it was applied, the location on the body, and any observations of the patient's condition. This information will be valuable for medical professionals when providing further care. Step 7. Training and practice. Regular training and practice are essential for effective tourniquet use. Familiarize yourself with the proper techniques through courses, simulations, or online resources. Practice applying a tourniquet on training aids or fellow responders to build confidence and proficiency. Conclusion: a tourniquet is a vital tool for controlling severe bleeding in emergency situations. By following the steps outlined in this tutorial and receiving proper training, you can effectively apply a tourniquet when needed, potentially saving lives in critical situations. Remember, timely application, proper technique, and seeking medical help are crucial components of using a tourniquet safely and effectively.